everybody. Tyler Suiters with the Consumer Technology Association. We're helping you get ready for CES, the biggest, most influential tech event on the planet. This week, one of the most important ways that technology is changing our lives for the better, and that's digital health. We are talking about health and fitness tech like wearables, medical applications like remote patient care, even scientific innovations, everything from research to surgery and training to do surgery. Also, wellness care for us is just getting more personalized, right? We are all able to take better control of our own health. So this week, my friend Kinsey Fabrizio, who leads CTA's Health and Fitness Technology Division, which covers a slew of innovative companies from across the spectrum, she is joining me to talk to a pair of digital health insiders. One of them has a deep medical background. The other is very much from the business side of the house. And together they're giving us a comprehensive look at digital health today, of course, but also where we're heading in the decades and even the next few months to come. You know, digital health is a sector that not only has great influence from big global tech companies, but also smaller businesses and startups are playing key roles, and we have great examples of that today. Joining us, first of all, from the former category is Dr. Dave Rhew. He is with Samsung Electronics America, where he is Chief Medical Officer and also the GM of B2B Healthcare for Samsung. Dave, good to have you with us today.
Thank you. It's great to be here.
Also, Matthew Stoudt is CEO of Applied VR, and I say small business startup category, but Matthew, I know you all are growing by leaps and bounds, and it's good to have you with us today, too.
Great to be here, likewise.
Well, thank you for joining us, guys. It is so great to talk about one of my favorite categories at CES, which is digital health. So first, I want to get into some of the great advancements we've seen in digital health over the last 5 years. Could you guys talk about some of your, in your opinion, your most promising advancements you've seen in digital health?
Dave, why don't we start with you?
Sure. Well, today we're starting to see a convergence of medical device technologies and consumer technologies. And one of the things where it started off is where you could view your data on a smartphone or a smartwatch, and that was great, and I think a lot of people got very excited over that. But where we're seeing it move is actually towards the point where your smartphone could actually control your medical device. Exciting developments that we're starting to see between partnerships. We're working with a company, Medtronic, one of the largest medical device companies, and we're basically enabling that to occur where both physicians and patients can use these devices. And this is where we're starting to move towards the ability for the smartphone to be able to control medical elements that we hadn't previously even envisioned.
That type of convenience is so important in consumers' lives. Matthew, do you want to talk about some of the great advancements you've seen in digital health recently?
Yeah, I'm going to piggyback on what Dave was just saying there. We're big believers in the power of technology to enable people to take control of their own health care. And with the advances in wearables and even the AI that's powering some of these wearables, the fact that we can now deliver some advanced technologies into the home are going to be pretty powerful tools. Some of the work that we're doing, even with Samsung here, is where we're enabling patients to get access to advanced pain management tools that now they can use in the comfort of their own home. We think are going to be great ways that are going to not only increase consumer and patient satisfaction, but also reduce resource utilization.
So let's step back for a sec on that note, Matthew. You and Dave have both talked at least about one aspect of digital health, which is health in the home. Is that here the real Rubicon crosser? Is that what makes digital health so remarkably promising in your eyes, the fact that we're breaking down the borders between a doctor's office and a hospital and care and access at home?
Absolutely. This is really the evolving landscape that we're seeing with value-based care, organizations starting to look at how you can manage the total care and really keep people out of the hospital. It's the most efficient way for us to reduce costs, keep them healthy. But in order to do that, you're going to have to engage them everywhere they're at. It could be on the go with mobile devices, but also in the home. And this is an area where we need to start thinking about what type of technologies do people use every single day? Do these technologies have the ability to capture the data relevant and be able to help provide some communications? But more importantly, then allow us to be able to draw insights so we can be more proactive in preventing people from getting ill. I mean, the smart home and all the smart devices are great mechanisms for us to be able to provide that communication, but ultimately it's going to be around the insights that we can draw from that and our ability to act on them in a proactive manner that's going to lead to better health outcomes.
So thinking
and
along...
what Dave is tapping into as well, so I was just going to quickly add on that, what Dave is also tapping into is just the importance of data that we're able to capture with all these, whether they're wearables that we have or just the power of our own smartphones. The notion of getting that data in a usable format to both the consumer as well as to the doctor, I think is going to be incredibly important.
So thinking along those lines and having more access to data, let's talk about artificial intelligence and how that is impacting the way healthcare is being delivered today.
Yeah, I will say that first and foremost, we are starting to see changes in the way that we address issues around proactive care. I mean, how do you actually keep people healthy and out of the hospital? In many cases, we provide a mechanism through telemedicine or maybe remote patient monitoring. There's some basic analytics around that. But what's happening is these sensors are getting better. We're starting to talk about devices that may even be implanted in one's body that we could get greater insights. We're talking about continuous monitoring, and then combine that with 5G and the massive computing potentials that we have on these smartphones and other devices. We now have an ability to be able to do more proactive care by using AI and machine learning to lead to more proactive care. But I would say that even beyond that, we're seeing AI being applied in other areas. One of the biggest challenges we face today with a lot of technology is it sometimes disrupts the workflow of clinicians, and we see this today in the electronic health record. And now imagine with some of the newer technologies of voice and image recognition, maybe with AR and VR, we may be able to improve the diagnostic capabilities of some of these tools that we have today, streamline that workflow, and ultimately make things easier for clinicians. So it's about helping improve the lives of patients and making things easier for clinicians.
Well, now, Dave, let's pull it back a little bit from outside of orbit when you drop something like implantables and enhancements there back into where we are today with artificial intelligence and AI. When you talk about Samsung and AI, maybe the most obvious example is voice recognition technology, and I think that's true for most of the consumer products we see in the AI applications. Where are you today in digital healthcare on AI in terms of what's working for you, what is actually being implemented today that you can find, and maybe what's ahead in the next year or so?
Yeah, I think today is just the beginning. We do have technologies to help with the voice recognition. As you're well aware, the Bixby solution that we launched and most recently showcased at one of our Unpacked events this past week or last week, showcased the ability that we might be able to then use voice and intercommunications where one could actually transition very seamlessly from one environment to the other. And that allows us to be able to think about workflow and lifestyle, because people aren't always in front of their computer, or they're not necessarily even in front of their device all the time. They're moving around, they're transitioning. And as you do that, sometimes the workflow and all the communications that allow us to be able to have an understanding needs to go with us. And that's the type of things that we're looking at. So it's not just about understanding your voice, but it's also understanding the context of where you're at. And then as you move to another device, how do you transition that over so that other device literally takes the ball and moves with that? So these are the types of things that we're starting to look at, combinations of how devices work together, applications work on them, and then including the really exciting elements of voice and image recognition.
Well, this will lead to such...
And actually, I'd love to give you guys... Sorry, go ahead, Kinsey.
No, you go ahead, Matthew.
I would also love to give you guys another real-world example of what we're doing today with the use of AI. And there also is actually a combination of AI as well as wearables. So one of the big unmet needs that we have in American society today is all around chronic pain, something that afflicts over 100 million Americans on a daily basis. I think 38 million of them are described as severe sufferers. These are people that live with pain levels that are over 7 on a daily basis. And we've developed a chronic pain solution that we're actually using your own biodata to help drive the solution that you see in VR. We're using breath as that input, and then we're tracking HRV as the output, heart rate variability. And if you teach someone nothing else but how to breathe properly, you can make a huge impact in terms of that person's ability to cope with their pain on a day-to-day basis. Now, we use basic diaphragmatic breathing around this, but each person's going to respond a little bit differently. And so this is where AI can play a big role in not only helping an individual, where we can fine-tune that person's breathing pace so that we can find that optimal zone for their HRV where their body is in the most relaxed state, but then we can also use that across the broad population so that each new person that comes in and tries this, we're able to, in a sense, almost use precision medicine to help the new people coming in to find that fast relief for them, for their chronic pain.
Matthew, that's so fascinating. And you touched on virtual reality. I would love to hear from you and Dave about some of the work you guys are doing with VR, using it as an alternative to typical treatment protocols. Can you talk a little bit about that?
Yeah, so virtual reality is something that's actually been around for 30 plus years in a clinical environment. That's been demonstrated with hundreds of studies that shows how it can actually be used to help abate acute pain. And with the advancements in technology and everything that's gone with the cell phone increasing its computing power, we have more computing power in a cell phone today than we did we have more computing power today in a cell phone than what we had to launch Apollo into space. And so with all that computing power, we can now deliver an incredibly powerful analgesic into the home or the hospital in a very scalable way using the Samsung 7 or Samsung 8. And we are we've been doing clinical tests at major hospitals all across the U.S., ranging from Cedars-Sinai to New York Presbyterian to Mayo Clinic. And we've been getting amazing results. The last study we did in concert with Samsung, we got a 52% reduction in pain. And we're just now at the tip of the iceberg in terms of how we can actually use this as a way to abate the opioid epidemic, which is just devastating America.
So let's take this as a bit of a case study then. And you all have two unique perspectives on this, in that Matthew, at Applied VR, as a VR company, you are a solution, in a sense, looking for problems to solve. And Dave, at a tech giant as innovative as Samsung is globally, you can address all kinds of problems with a variety of solutions. So let's start with you, Matthew. As a case study, is VR a fair example of technology applications in digital health, and that we are innovating so quickly that we'll find solutions as we go, as technology develops, as connectivity expands throughout our daily lives?
Well, this is one example with digital health as opposed to traditional healthcare. When you think about the world of molecules, well, we're able to get real-world evidence. And actually, by getting our product out there and seeing how patients are using it, we're able to identify new uses that we never would have thought of. And I'll give you just two simple examples of that. One, we had an innovative OBGYN who was using our product in his practice with women, and a woman presented. She wanted to try to deliver naturally, and he said, well, I've got this pain abatement tool from Applied VR. Do you want to try it? She ended up delivering naturally. She was in our VR device for the Samsung. She was in there for 2+ hours, and the doctor literally had to ask her to take it off if she wanted to see the birth of her child. That then launched a huge influx of inquiries from literally all around the world about our labor and delivery platform, and we didn't even have one. So we ended up turning around and going out and building something that was specifically for that. And then another example of this is with our chronic pain solution. And with chronic pain as opposed to acute pain, chronic pain is you're not going to change or solve someone's chronic pain. What you're going to do is you're going to help them deal with their pain on a day-to-day basis, cope with that pain. And then you also have to think about the behavioral health impact, the depression and anxiety that sets in, the catastrophization, the fear of movement, the sleeplessness. And so it's not just about trying to go after the pain, but it's about also going after all the comorbidities that exist with it. And so with our chronic pain solution, that includes cognitive restructuring, CBT, acceptance commitment therapy. With that program, we had a patient that was using it in her home, and she started to, every time she would go into it, she would have these massive crying sessions. And she thought maybe something was wrong with the platform or something was wrong with her. She talked to her doctor about it, and he said what she was having was it's called a release. She's diagnosed with something called complex PTSD, and he said that typically in therapy, it takes years to be able to get to a release. And in this situation, she was able to get there after using our solution only 4 or 5 times. And that type of impact, I think the more we get this out there, the more we're going to learn, and we're going to identify amazing use cases that we never would have thought of on our own.
Well, and a big part of getting this out there will be getting the physician community on board. And I'm excited to talk about with our listeners that for the first time, CES will offer continuing medical education credits for the Disruptive Innovations in Healthcare Conference. And can you guys talk a little bit about how impactful that will be and how important it will be for providers to attend CES and get CME credits?
Yeah, I'm excited about it. First of all, I'm a physician, so for me, it's interesting to be able to think of CES as an opportunity to get CME. But I think it's actually a natural extension of where CES is moving towards, which is looking at making this consumer technology more medically relevant. And as part of that journey, you're going to need to get physicians to be aware of the types of things that are out there, helping to test and validate them, and really become key leaders in this space. We believe that the Health and Technology Fitness Division within CTA has really been a key driver for the journey towards combining healthcare with consumer technology. And to that point, I think many of the solutions that we're now talking about are not just about great technologies, but there's a lot of validation, clinical validation that substantiates that this is actually better than or just as good as existing medical treatments. So we now know these to be real medical treatments. They just so happen to be on a consumer technology device.
You're both CES veterans, right? You've been to a number of shows. You've had the important conversations, made those valuable connections that pay off. Dave, let's start with you. What is the balance that you need and you see at CES among medical professionals, among technologists and innovators, among the VC world or the investors? It's an amalgamation of industries or sectors within the industry that keep this thing going, right?
Absolutely. We're seeing a maturation of the digital health industry, and that's reflected in what we're seeing and experiencing at CES. CES started out as an emerging showcase for cool digital health technologies directed at consumers. But now it's a forum where consumer tech companies, healthcare providers, medical device firms, the FDA, and other key stakeholders and participants are able to discuss, showcase, and plan for digital health solutions that can make a meaningful impact on patients' lives. It's a outstanding opportunity to network, learn more, and ultimately understand what the future is.
Matthew, you want to jump in here?
Yeah, I really look at CES as a way of looking at those future trends that are not as future as you think. By that, what I mean is, we talk a lot about wearables. And so when I go to CES, I find that it is an invaluable opportunity to go and in one shot get to see about 30 to 50 different types of wearable technologies that I can now have a meaningful conversation and say, how can I actually use this, leverage this to make an impact in people's lives? And it's that window into that people call it the future, but it's the future that's now that is so beneficial to us. And at the same time, especially now, tying it back to the CMEs that are occurring, the more and more that we bring in industries that you typically wouldn't think about from a consumer perspective, healthcare is definitely one of those. I think it's going to just make that CES so much more valuable for all different types of companies. And the other thing is, I always think about innovation occurs not necessarily in, David is driving innovation at Samsung. We're trying to drive innovation in the world of VR and AR for healthcare, but also innovation occurs with the people that are sort of that independent shop, if you will. And so when you think about CES almost as a bazaar where you're going to go out there and you see doctors walking around and they see different types of technologies, that starts to spark in them the idea that maybe I could use this to help one of my patients. And then you see how that would then turn around and they start coming back and have an idea. They want to take that idea to a Samsung and say, can you help me do this? Or you come to an applied VR and say, hey, I want to build this. Can you help me? That becomes a rich, robust fertilizer for driving continued innovation and everything that Dave and I are trying to do.
So, following up on that, when you think about your game plan for CES and getting ready to attend CES 19, what are you especially excited to explore and investigate?
As most of you know, why don't you go, Matthew?
No, you go. You got it.
All right. Well, I think most of you that have been to CES have seen that Samsung has a pretty strong presence there. It's a very important event for us. We use this as an opportunity to showcase some of the coolest and most cutting-edge devices and solutions to the market. And as we look ahead to 2019, I think we can expect to see more of those innovative solutions and devices, but perhaps a bit more focused on things that we're talking about right here: IoT, 5G, artificial intelligence, voice, and connecting that experience for both the consumer to around all the different things around them, as well as for the enterprise customer. And we're going to continue to see these advancements that allow us to be able to streamline that user experience, whether it's on the home or in the go.
So when we're walking around on the show floor at CES 2019, can we expect to see some great demos from Samsung and Applied VR together?
That's our hope. Yeah, we're currently innovating. We've got some pilots underway. Hopefully the timing will be right for us to be able to showcase some of that at CES 2019.
Yeah, and on the Applied VR side, along with Samsung, we hopefully will have a few big announcements that we'll be making at that time. So looking forward to it.
All right, we'll let you unbox all of that actually on the floor, and won't make you undo the bow just yet. Simple question for both of you, and Matthew, let's start with you. What's next? When you think about the digital technology sector and digital health, what's next? What isn't here that is, in your mind, on the way and has you most excited?
Yeah, so again, just going back to that connection of mind and body, you'll hear that as a repeating theme for us. I think what we're looking for is how do we tap deeper into the mind side of the equation. And so we think about devices that can actually read the EEG, the brain waves that are going to tell us a lot more. It's another way that we try to get into understanding the individual person and how we can make an impact on that individual.
And Dave, what about you? What do you expect to discover at CES 2019? And I'll extend that to 2020 if you need a larger window for what you think is on the horizon.
If you just look at the trend, we're going to see more advanced sensors, better diagnostic capabilities, non-invasive measurements of things that we hadn't seen before, ability for us to be able to apply artificial intelligence and machine learning to apply the data that come directly from one's devices, as well as potentially pull data from the electronic health record and claims data. I think this whole issue around open standards and trying to create an opportunity where consumers are in charge of their own health and using these devices around them to be able to gather that information and communicate it with others. Tremendous amount of opportunities. We're really excited to be a part of many of these solutions, and we really are excited to see all the things that are planned for 2019 and beyond.
One last question I want to ask. We planned to have a VIP physician tour on the show floor this year, taking doctors around to see the health and wellness tech exhibits. In your opinion, how impactful is that to physicians, and how do you think they will react on the tour?
Well, I think, first of all, it's a great idea because CES can be a bit overwhelming, and not even knowing where to go and where to start and understand how this technology fits into one's workflow or one's practice is oftentimes a big challenge. So if there's a way that one could direct people in a very logical way throughout the showroom, tell them how this is relevant to them, highlight the key parts, make it faster for them to see the stuff, understand it, And I think ultimately you're going to get greater interest in the things that they see. So part of it is just because it's just such an overwhelming experience that it's hard to know what to see and where to focus on. But if we can do that and we can provide that level of structured guidance, I think that's going to be highly effective, and particularly for this audience that are newcomers to this, where they may not necessarily even know where to start.
Well, and I'd go one step beyond that, Dave. It's not only about navigating what can be completely overwhelming, and I totally agree with that. I also think it's if we can find a way to create a mouthpiece for them to get the word out as well. Because when you think about driving behavior change within the clinical environment, it's really about going after some of these key opinion leaders and getting them to turn around and talk about what they saw and how they see it's going to impact their own practices or how it can impact other practices. So I think that this is a fantastic idea to be able to go out there and help get the word out.
You mentioned behavior change, which is such an important component of technology integration into healthcare. Can you talk about some of the things that you all are doing to lead to behavior change and consumer engagement?
Oh, this is a great topic, and I'll tell you, this is something that we've learned both from experience and also from failure, that simply putting out medical, or I should say consumer devices such as wearables, doesn't lead to improved health outcomes. Because why would somebody want to use this device on an ongoing basis? In some cases, the data, you already kind of know how many steps you took or kind of where you're at. It doesn't provide that ongoing value proposition. So what we realized is that the customer experience, the consumer experience of why they would actually want to use this is perhaps one of the most critical things we need to start thinking about. And this is the stuff that we have ultimately just started to realize that we have to design it in our products, and also as we push it out, provide programs around this. So a couple of examples, with the smartwatch, for instance, one of the things that we realized in a population that typically does not use technology, we're talking about seniors over the age of 85, what we did recognize is that they actually want to live independently. So you put a mobile PERS, or a personal emergency response system, on your smartwatch, and with one push of the button, you have an ability to literally have an ability to reach out to anyone if you ever have trouble, to help me, I've fallen, I can't get up. And these type of ways that we have learned to incorporate these elements that are intrinsically tied to the motivation of why one would want to use it continuously and every day are so critical for us to be able to understand then how this can serve as a platform for everything such as medication reminders and other ongoing communications. So engagement is a critical first step, and it needs to be tied into how we develop it and deploy it.
Behavior change is actually the basis of our founding. We came out of a market research firm, and traditional market research, you think about how people make decisions. We like to think they're made rationally. The reality is that we make them based on the non-conscious and the emotional. Now, when you think about applying this to chronic disease conditions, and again, I'll go back to the chronic pain as an example of this. In this world, it's about getting people to do something on a repeated basis, and it's adherence in the world of medicine, right? How do you get someone to adhere to their protocol? And so we like to think about this through what we call the 3 E's. It's got to be easy to use, it's got to be engaging, and those two lead to it's got to be effective, or they'll translate into efficacy. On the first one, as Dave mentioned, this is an older population that you're going after, and especially the oldest of them are definitely not the most tech savvy. So you've got to have something that is just ready to go out of the box. If it's complicated, if it's hard to use, then they may do it the first time, but they're never going to do it again. The second thing then is it's got to be engaging. How do we make this feel like as easy as taking a pill versus the feeling like you're getting up and having to go do a chore at the gym? And so it's about that taps into behavioral dynamics, and that taps into connecting to the emotional and the non-conscious, giving that person rewards for completing different things so that they feel better at that non-conscious level. And both of those things, if you deliver on those two things, you're going to have a product that's effective, that delivers that efficacy. And that's ultimately how you change that behavior.
Matthew Stoudt is the CEO of Applied VR. Dr. Dave Rhew is the Chief Medical Officer for Samsung Electronics America. Gentlemen, great conversation, and looking forward to seeing you at CES in just a short while.
Thank you
Great.
so much.
Thank you.
All right, next week, everything 5G, if you know that term. And if you don't, you're going to know it awfully well. This is not just what 5G is, but it's all the innovations that will ride on what is going to be a lightning-fast network. So, of course, consumers are going to love it, right? Better connectivity, faster downloads, no latency. But this is also going to be a game changer for businesses.
You need reliable connections and so forth, and that's going to, when you have that introduces a whole host of other benefits, and that introduces greater efficiencies, better choices, and maybe speed to market.
Hey, thanks everyone for joining us yet again. And a reminder to you before we leave to subscribe to this podcast. That way you can catch all our episodes, including the episodes that we are bringing to you from CES 2019. Speaking of, January 8th to 11th in Las Vegas, those are the dates for CES 2019. And we have the info you need all at ces.tech. That is ces.tech. As always, I am totally propped up by our two podcasting superstars, our producer, Tina Anthony. Thank you, Tina. And our engineer extraordinaire, John Lindsay. You all are the best. I'm Tyler Suiters. Let's talk tech again soon.